Hey guys, my name is Nicole Hindy and I am in the FNP track at EKU and I'm doing my topic on pediatric obesity. Here's your YouTube link. So this specific problem that we're looking at is obese pediatric patients and how family involvement affects the compliance of the child's weight loss plan. Some supporting evidence: 12.7 million obese children and adolescents are across the nation. Obesity has tripled since the 1970s. Kentucky, which is where I plan to practice as a family nurse practitioner, is ranked 5th in the nation for obesity. Less than 30% of high school students get 60 minutes of physical activity every day, and obese adolescents will develop a greater risk for early death, heart disease, stroke, type 2 diabetes, depression, and some cancers. So study 1 included 42 obese adolescents that were selected through 4 different Y coaching programs in Korea. Exercise classes were offered twice weekly and nutrition classes were offered once a month. Parents' attendance was required to attend these classes, so they had to go with their children to the classes. And the control and experimental groups were offered the same classes. The experimental group just had weekly emails, newsletters, and or text message reminders that were sent to the parents each week. There was a dietary self-efficacy score that was recorded. Exercise frequency and BMI was also recorded during the 5-week period of the study. Dietary self-efficacy was slightly increased in the experimental group, and that is just basically how the adolescent views their dietary knowledge. Exercise frequency was slightly more in the experimental group, and BMI had no significant change with the 5-week study. So overall, the study showed the importance of family involvement in a child's weight loss plan, but a longer research study would need to be conducted to provide better results. Study 2, 3 obese adolescents were selected through one multidisciplinary weight management clinic. They had to have a BMI that was greater than the 99th percentile, a family history of obesity, psychosocial stressors, multiple obesity-related comorbidities. They were provided support through multidisciplinary treatment, frequent office visits, and temporary living arrangements. 2 of the individuals went to a weight management treatment center during the first couple months, and the third child went to a supportive family member's home during the first couple months of the weight loss program. All of them lost weight during the first couple months away from home and resolved and or improved their comorbidities. 2 of the children had increased family support and physical activity when they returned home, so they continued to lose weight. One of them dropped 21.1% of their weight, and the other was 30.2%. The third child had the same or less amount of family involvement once they went back home, so they actually gained the weight back that they lost and went above that to 26.7% of the starting weight that they began at. The impact of weight on quality of life questionnaire was provided, and that basically states that a lower score equals a lower quality of life in an individual. So the 2 that went home with the increased family support scored a 74.07 and an 82.41, while the one that went home with less family support scored a 47.22. So quite a difference in that questionnaire and quality of life result. Overall, study 2 concluded that weight gain and loss is affected by family support and involvement in the multidisciplinary treatment approach. This is the synthesis table, and it's basically just showing that family involvement and exercise, like support for the adolescents, was an intervention for both of the studies. Text reminders to the parents of the children in the study was for study 1, and then in study 2, they had a multidisciplinary weight loss treatment, and they had the temporary relocation. So both studies determined that family involvement in the weight loss plan of an obese pediatric patient does affect their compliance. Study 1 includes families by requiring their attendance at classes, and the experimental group had the weekly reminders. Study 2 included families during multidisciplinary meetings. Encouragement of increased support and involvement at home was provided as well. Future research studies, they concluded that to provide better accuracy, both studies would need a larger sample size, and they would also need to do a longer research study. So the one was only 5 weeks, and so they would have to do something that would provide a more valid result. So the proposed intervention as a family nurse practitioner, we will need to encourage parents and families to be involved in the child's weight loss, healthy eating, and exercise plans. We can do that by providing weekly emails, just like they did in Study 1, with the nutritional facts, exercise reminders, and encouragement. It doesn't have to be something long, just enough to give them some encouragement and some reminders. They need to require follow-up appointments with the parents to track that progress together. If a multidisciplinary treatment approach can be done, then that would be great. I know that's going to be kind of difficult to do in clinics a lot of the time, but and the National Institute of Nursing Research states that the best way to overcome the symptoms of an illness is to prevent the illness and disease from occurring in the first place. So educating on a daily basis about obesity and healthy eating and exercise is really important to prevent it from occurring in the first place. The environment that this will happen or that it'll take place in is the primary care provider, the office, the primary care provider's office, weight loss clinics, dietitian offices, can be done in schools and at the local gym. It's just wherever you plan to be as a family nurse practitioner in the future is where you can do this education. And then there are the references, and thanks for listening, guys.